this would actually play out in the real world in clinical practice. So I'll take an example, first of all, of the treatment and understanding of eczema, for example. Eczema is symptomatically treated in modern dermatology, mainly by the use of cortisone creams and steroid creams, which suppress the inflammation very effectively, but actually that will wear off after a few hours, and there's no further benefit other than the tangible benefit of removing inflammation for a while. So this is especially bothersome if you're working in paediatrics, if you're working with small children who might be just a few months or a couple of years old, who are tearing their skin off with inflammation and itching and bleeding, and have to wear cotton gloves to try and stop the child from pulling itself apart when it's asleep at night. So in 1990, in London, UK, in the Great Ormond Children's Hospital, the paediatric dermatologists there, Atherton and Rustin, were treating obviously a lot of small children with paediatric eczema, and they noticed that one of those children suddenly made a big improvement over the matter of a few weeks without having a steroid treatment. So they said, "Oh, that's a bit strange. What have you done to help your daughter?" And she said, "Well, I took her in desperation. I took her to a Chinese herbal medicine practitioner in Soho in London called Dr. Lee, and she gave her this brew of Chinese herbs to swallow." Now, a lot of hospital physicians their response would be, "Ha ha ha, that's obviously a silly thing to do, you mustn't do that, and that must be imaginary and all in your mind." But Atherton and Rustin were bigger than that and were more investigative, and so what they did was to say, "That's interesting, could you give us contact details?" So they then called Dr. Lee in to the hospital and said, "Listen, here's 70 terrible pediatric eczema cases, see what you can do with those." And much to everyone's surprise, they mostly improved. It was something like 70–75% of those children significantly improved in that trial, in that small trial. So they got excited by this. And they managed to get funding to do bigger trials, and in the medical literature, in the British Medical Journal in the early 90s, they published a few papers of clinical trials of Chinese herbs for the treatment of eczema involving over 1,000 people, 1,000 children, and they mostly improved. So this was a ripple through the medical world at the time, and there was a lot of excitement about the value of Chinese herbs, which seemed to produce a lasting improvement in many patients, even if eventually, after 6 months, a year or so, many of those patients began to get their eczema back. But still, that was avoiding giving powerful steroids to small children. So that's how things developed, and it was covered in the media a lot. It had a knock-on effect on my practice. I ended up seeing a lot of dermatology patients through the 1990s. I was prescribing between 3 and 5 tons of Chinese herbs on skin conditions alone, so I managed to get a lot of experience of doing this. But doctors in the hospital in Great Ormond Street thought that all the 10 herbs in their prescription must be a smokescreen. That there was, in their view, because of the magic bullet single chemical idea, they imagined it must be one herb in her prescription that was having the effect, and more than that, there must be one chemical in one of the herbs in the prescription that they could then pull out and identify and market as a miracle new drug for eczema. The Chinese doctors, of course, said, no, there are different herbs in the prescription doing different things, and they're all contributing to an overall effect, and we're tailoring the proportions of those herbs and the particular herbs we're using according to the individual case. So it's more than simply this is what we give for eczema. So the Chinese traditional doctors, Chinese traditional dermatologists, said that there were some of the herbs in the prescription were there to get rid of dampness, and actually one of the names for eczema in the Chinese medical language is shuchuang, which means damp sores. So they said some herbs were there to get rid of dampness. That's the exudate. That would be shown by when you scratch getting fluid, straw-coloured fluid coming out. And they said other herbs in the prescription were there to clear heat and to cool the blood, to take the inflammation, to take the heat out of it. And some of the herbs were to get rid of what they called wind, which is shown by itching a lot. And the itching is like shaking of leaves under your skin, the way the wind rattles leaves like that. So some of the herbs were traditionally used for getting rid of wind, whatever wind might be. And other herbs were there to get rid of what they called toxicity or radu, on some cases, but not all. Not everybody would get that. And there were other herbs in there to help the skin get nourished properly and to repair. So they said it was a strategic package matched to each individual that together gave a therapeutic effect, that it wasn't a single chemical in a single herb. It wasn't all a smokescreen of weirdness, that there really was some sense. So this is what the Chinese said. Well, the pharmacologists got hold of it. Atherton and Rustin decided that they would send the brew off to a pharmacology department. I think they sent it to Sheffield University in the United Kingdom and said, will you find out, please, what the substance is in this brew that has its effect? So this took them a little while, it took them a year or something like that. What they found was, in the pharmacology studies, was that some of the constituents in the herbs improved skin microcirculation to flush away and remove exudate. Some of the herbs were anti-inflammatory. And they discussed the different anti-inflammatory mechanisms from the different substances in the brew. Some of the herbs had antihistamine effects. Some of the herbs inhibited bacteria, staphylococcus for example, which can form a secondary infection on the open skin and make the situation worse. And some herbs they found aided local tissue nutrition and repair. So actually, the prescription did exactly what the Chinese medicine principles said. So those principles of clearing heat, removing heat and inflammation, removing exudate, clearing infective materials or what have you, that actually the Chinese medicine principles actually could be matched to pharmacological principles that were the same. So the pharmacologist said, we can't there isn't a single substance in this. It actually works together as a strategic whole to deal with all the things that go wrong in eczema, which I think is really interesting. It's interesting that I live in Chinese medicine world in many ways, but it shows that this is not an accidental folk medicine, that there is a systematic, principle-based understanding of the physician who's developed the skills to look at a problem like that and to look at how much redness there is, how much exudate there is, and if there's very little exudate and it's very dry, then you wouldn't put the herbs in for the exudate, and if it's very dry you might put more herbs in to help nourish the skin, for example. So this is the way that the treatment is tailored towards the individual in a strategic way that is based on some kind of interesting principles. Those principles, using the words of a foreign medicine, are pointed to and say, oh, yin and yang and heat and fire and dampness and inflammation, all sounds very weird to us, pharmacologists or doctors or what have you. But actually it's a technical terminology that is useful to navigate through the clinical landscape of humans in health and disease. So that's some insight, I think, into the way that Chinese medicine can be taken seriously, and the way that any illness we choose, eczema for example, is very complicated. When people have eczema, there's not one thing that goes wrong, there's a whole package of things going wrong altogether. It's really complicated. And here's a slide that kind of summarises some of the things that have been found in eczema. So it would be ridiculous to imagine that that a single chemical, a single anti-inflammatory would fix the whole thing. That cortisone is the best treatment possible. On the current evidence, I would say that Chinese medicine is almost certainly the best possible, because it makes sense, because it's strategic, because it is wise in many ways. So this is really what I would say is strategic polypharmacy based on principles that go back 2,200 years or so. And we can look at almost any, the analysis of almost any illness by Chinese medicine, and we can look at its understanding in biomedicine as well. And I could just spend a minute or two giving another example very quickly of the situation of bronchitis, where in modern medicine you get acute bronchitis. The doctor will say, that's caused by a bacteria, so I'll give you an antibiotic and that will fix the root of the problem. Actually, if you look at the research evidence, you'll find that antibiotics are not supported by the evidence for the treatment of bronchitis. That on the research, they're not really very effective at all. And the interesting thing here is that modern medicine has focused on that single bacterial cause and will shoot that dead. But of course, when you get an infective condition in the lungs, a whole lot of other stuff kicks in too. It's not simply the presence of bacteria, it's all the consequences on the lung physiology that kick in. So we have tubes. Basically, the lungs is a tube system lined with cells that produce thin, slippery mucus, clear, thin mucus that's supposed to be there, and then embedded in that mucus are hair cells, cilia, which are constantly wafting that mucus layer up and out, so that any pollen or any dust that gets inhaled can get removed slowly. But when we get bacteria establishing in that mucus, then the mucus begins to thicken and becomes harder to move. So the cilia, instead of being able to vibrate at 2,000 vibrations a minute, will drop down to maybe 200 or 300. They're struggling to clear that mucus, so the lungs begin to clog up with mucus. It begins to dry out and go thicker, so it's no longer that clear stuff that's easy to move. The goblet cells, the mucus producing cells, start to push out more and more mucus into the system to try and flood the thing away. The inflammation gets into the tissues and makes those muscles surrounding the airways spasm and tighten. So you get tightness in the chest, you get mucus, you get inflammation getting into the system. So we've got a whole panoply, a whole package of pathology that's all happening together. And so in modern medicine, it's simply a matter of saying, okay, you have these antibiotics, that'll do it. Whereas when we look at Chinese medicine, we can see that this is a whole complex situation, and that the treatment of it has to deal with all the situation all at once. So there's a famous prescription called Ding Chuan Tang, which was invented in the 1400s. I think it first appeared in a book of about 1410, and it's 2, 4, 6, 8, 10, 11 herbs that are again a strategic plan to deal with that situation of an infective bronchitic episode. So it contains ma huang, which is an ephedra bronchodilator, which stops the lungs from spasming and tightening up, stops those airways from closing up. It has huang qin, which has anti-inflammatory and some antibiotic properties. It has sang bai pi, mulberry bark peel, mulberry root bark, which has anti-inflammatory effects. It has banxia in it, which reduces the overproduction of mucus by the lungs. It has a whole load of things that just match everything that needs to be done. How they worked out this without knowing any of the science that we know today. I have no idea. But when you put those side by side, when you look at antibiotics, a one-off single thing like that, and you look at a strategic approach that takes account of what's gone wrong in the person as well in response to the bacteria, we can get some idea, we can get some inkling of the sophistication of the Chinese medicine tradition. So it's not folk medicine, it's strategic polypharmacy done according to principles. And that's, I believe, what makes Chinese medicine so interesting and so valuable in the modern world, because when I look at it as a scientist, I can see that this has a depth, a potential depth to it that is more clinically real and more valuable in many ways than modern medicine. But again, that's not to criticise modern medicine, because I hope that modern medicine catches up. And modern medicine is beginning to look into this business of how we deal with complexity and using systems theory ideas. So yes, modern medicine will come to similar conclusions, and I would like to predict that it will begin to use a more polypharmacy, more strategic polypharmacy approach eventually. So these are the effects of that famous prescription. The cilia are stimulated to clear more, there's an antibiotic effect, the inflammation is dampened, the smooth muscle that spasms in the lungs is relaxed, the mucus production is turned down, and local microcirculation is improved as well, which is just remarkable that we can have a package of substances that have all those effects. So, in summary, this is my attempt to create a deeper level of insight than talking about meridians and qi and yin and yang and what have you, which are simply convenient labels and terms for the actual explanatory model that a great Chinese medicine physician has. But that's the issue, really, that to acquire those skills where you can write a well-pitched prescription for an individual that just hits the spot absolutely perfectly is actually quite a high-level skill. It's not something you can learn in a week or a month or a year even. It's something that you do years of study and then you do years of experience, and gradually over time you get good. So what's interesting about Chinese medicine is that the power of Chinese medicine is in the person doing it. It's their degree of cultivation that gives them power to make a change. And if you don't have that cultivation, it doesn't work. Whereas the power of modern medicine comes more from courtesy of the pharmaceutical industry. That the doctor himself doesn't have much play in getting the patient better. What gets the patient better is the skill of pharmacologists. And those are two interesting things, and they're not mutually exclusive. They can both be valuable to real patients in the modern world. So my aim in this is to try and convey as clearly as I can some of the sophistication and the seriousness of this medical tradition